Jenny again, and I just want to talk to you a little bit about kind of the ins and outs of insulin. So dogs, oftentimes when they're prescribed insulin, they will get a vial like this. Dogs typically need more insulin than cats do. So pet owners of canines tend to go with this size bottle of insulin. Cat parents oftentimes will get what's called a pen. So this is an insulin pen. This is what it looks like. The top comes off like this. So this is it has less insulin in it than a vial, and oftentimes it's more cost effective for cat parents. Insulin can be and should be stored in your refrigerator, on the shelf, not on the door. It is good for 6 months in the refrigerator. You always want to double check the box and check the date of your insulin. Make sure that it's not going to expire, say, in like 2 weeks. Okay, you want to make sure that it's good. If you have a clear insulin like Lantus or Glargine, those insulins look like water. They're clear. If you ever pull it out of your refrigerator and it's cloudy, it's gone bad, and you should toss that and just pick up a new vial or pen of insulin. We keep it in the refrigerator because a lot of pets, they won't necessarily go through the whole vial or the whole pen within, say, oftentimes it's longer. It's like 6 weeks, 8 weeks maybe before they run out of insulin. So that's why we keep it refrigerated. If you forget and you leave it out on your counter for a few hours, it's fine. Insulin can sit out on a counter for 30 days. So you can just put it right back in your refrigerator. If you have forgotten to put it back and it's been out for a few hours, it's perfectly fine. So it's important to know that insulin is very sensitive to heat and sun, and it can't be frozen. So in the summer, what I always tell families, if you're running errands and you know you have to pick up your pet's insulin, do it last. If you're going on vacation with your pet, take a little cooler and an ice block so you can put the insulin on the ice to keep it cool. If you are if you have a dog and you're sent home with a vial, what you want to do is you're going to get your syringes. So insulin syringes should say U100 on it. Most of the insulin that is prescribed by vets for animals is called a U100 insulin. It means that there is 100 units of insulin per 1 ml. So you want to check your box of syringes, make sure they say U100, it should match. Different syringes would measure, the lines and stuff are different, and so you wouldn't be getting the same dose. So you always want to make sure U100 insulin, U100 syringes. So the way you open an insulin syringe, you're going to pull the cap off the back, and then you want to just, move the plunger up and down a few times to get it loose so you can easily draw it up. And insulin is measured in units. So when you look at your syringe, the very top line that's longer than the other ones, you want to ignore that and go to the first line underneath, and that would be 1 unit. Sometimes insulin syringes have little tiny half lines on the left-hand side. If that is the syringe you have, those are your half units. So if you're doing 1 unit twice a day, and the vet decides, to increase it to 1.5, you would just go down to the 1 unit line and then down a little bit more to the half line. Okay. Some insulin syringes do not have half lines. So if you have one of those, it is still read the same way. You're still every line is still going to be 1 unit. Okay. So it's pretty easy to read. It's not that difficult. If you are given a vial, you can wipe the top off with some alcohol, if you want to. I always tell people, keep the box that your insulin comes in and store it in the box in the fridge, and that helps to keep it clean. But you're more than welcome to use alcohol to wipe off the top. That's always good. You flip it upside down. Oh, before you do that, when you get the insulin vial out of the fridge, you want to roll it gently between your hands, okay, to help mix the different components of insulin. Don't shake it, just roll it. This is just water in here, but it kind of looks like clear insulin, like Lantus. So you take your needle, you put it in the top, you flip it upside down, and you're going to draw out your insulin. So if there are air bubbles in the syringe, the easiest way to get rid of them is just to push everything back in. Then redraw it out. So I always go past the number that I need, and then I slowly go back up. So say I need 5 units twice a day. The top of the plunger is what is going to be on the number 5. The bottom part of the plunger is below the 5, and that's fine. You measure from the top of the plunger on the syringe. Okay, so that top black part should be on the 5. Okay, then you take it out. So our patient, when we're giving insulin, we do it sub-Q. Sub-Q means subcutaneously, so we go under the skin. So you want to be in the scruff of your pet's neck. That's the place normally where they have the most skin. Insulin is absorbed through the fat, and so you want to have the excess fat and loose skin up here to give your insulin. You're going to do what's called tenting. So you're going to pull your pet's skin up, pull the scruff up, and then right here where there's like a divot, that's where you're going to put your insulin. Okay, so you just do a slight angle with your syringe and you give, and that's it. You want to rotate your sites. So I just did, so say this was breakfast for this patient, I just did it on this side, so maybe dinner, I'm going to come over on this side, or I'm going to come over on this side. You want to rotate all around in the scruff so that you're not injecting the same spot over and over. And the reason is because if you keep injecting the same spot, it will form scar tissue and they won't absorb the insulin as well. If you have to draw insulin up from a pen, because there are these things called pen needles that go with the pens, but we don't use them in veterinary medicine because there's a few reasons. With the pen, you dial up the insulin traditionally. So you would turn this little dial and you would put it on whatever number, if you were a human, you put it on whatever number your doctor told you to. Then you would put a pen needle on the end, you put it underneath your skin, and you inject it this way. The reason we don't do this with animals is if you're dialing up insulin in the pen and you go past the number that you need, you can't really undial it. So you have to squirt it out in the sink, get a new needle, and start over. So it wastes a lot of insulin. Also, the pen needles, some pharmacists will try to talk you into buying the pen needles. When you do this with a pen needle, you have to hold it under the skin for at least 20 seconds to make sure that every drop gets in. And most animals are not going to tolerate that at all. So that's why we don't use the pen needles, and that's why we don't use the dial with the insulin pen. You're going to use this exactly like a vial. So you're going to flip it upside down. You're going to stick your needle into the port down here at the bottom. And then you just draw your insulin out the same way you would as if it were a vial. Okay? So, and then you do it the exact same way. You bring your pet over. If most animals react very well to the insulin needle, it's very tiny and fine, so they tolerate it very well most of the time. And again, you're just going to tent the skin, and you're going to put your needle in at a slight angle and then push it in. The thing to know when it comes to giving insulin is if you accidentally go through the fur, like you think you're in the skin, but if you have a medium or long-haired dog, you might only be in the fur, but you don't realize it, and you give the insulin and the fur's wet and it runs down their body. That happens, and it's okay. Don't re-give it. We never re-give insulin if that happens because you don't know how much the pet actually got. So it's better to just wait until the next meal time and then give it. If you go to feed your pet and you're having a hectic morning, you have to get your kids out to school, something's happening and you're running around crazy, you feed your pet but you don't remember if you gave the insulin, don't re-give it. Just err on the side of, okay, I gave it, and then worry about the next dose at dinner time. Because you don't want to double dose your pet and then leave. Having too much insulin in the body and not enough sugar causes something called hypoglycemia. Hypoglycemia, or low blood sugar,